Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear an interview about a career development in occupational therapy. You now have 90 seconds to read questions 31 to 36.
Hello, Mrs. Craig. Mrs. Craig is an honorary fellow at Bridgemont University and is a regular contributor to the official journal of the College of Occupational Therapists. We are pleased to have you here today to talk about career development in occupational therapy. So, please start off by giving us a little bit of history about the topic.
Yes, thank you, James, for the introduction. I am very happy to be here to talk about a topic that is near and dear to my heart. Until about a decade ago, occupational therapists in the United Kingdom were fortunate in that demand for therapists exceeded supply. There was little need to think of career development since posts and promotion aspects were plentiful.
I understand that you're implying that the situation has changed over the years. Is that correct?
Yes, and that's quite correct. Today, occupational therapists face the same challenges in finding a first post and developing their careers as others do. Fortunately, many of the attributes that make for effective practitioners in the field of occupational therapy are also valuable in professional development. In particular, flexibility, creativity, problem-solving, and lateral thinking.
What have occupational therapists done with these areas of strength?
Occupational therapists have combined these strengths with entrepreneurship to move the profession beyond familiar areas, such as the National Health Service and social services. We're starting to see therapists work in a much wider variety of posts.
Quite interesting. What role has the College of Occupational Therapists taken to encourage this development?
The College of Occupational Therapists has lobbied quite a bit for a change in how occupational therapists are educated. As a result, universities have started to prepare graduates for the future through providing role-emerging placements as well as including courses on entrepreneurship in the standard curriculum. There is evidence that this change in the curriculum has encouraged new and developing areas of practice in the field, such as low vision and driving. This is a wonderful development because just as our profession has become more diverse in the UK, employment patterns and career paths have become less predictable, which means therapists need to be prepared to be more proactive and flexible in developing their own career paths.
What exactly do you mean by flexibility?
I mean that graduates seeking a first post need to be willing to start where opportunities occur and to work to create a path towards their ultimate goal instead of holding out for that perfect opportunity. A short-term post in occupational therapy or a related area can provide both experience and an employment reference. This can be combined with postgraduate study to widen knowledge in a preferred area and enhance employability. In addition, working in the voluntary or private sector provides a different perspective that can be applied to work in the public sector. In the end, each therapist has to make choices that will move him or her in the direction of the next career goal, and also be open to discover new areas in the field not previously considered.
What kind of career path do occupational therapists with a bit of experience tend to pursue?
Once experience is gained, most therapists pursue a clinical career, but other avenues also exist, for example in management, education, private practice and research. There are now more opportunities to combine roles in lecturer, practitioner or clinical researcher posts and to pursue private practice on a part-time basis. It is becoming more and more common for therapists to work for different employers and to move between the public, private and voluntary sectors.
So what role does continuing professional development play in the career of a therapist?
Well, continuing professional development is at the heart of an occupational therapy career. It is the link between a current post and future aspirations, and it can help to maintain a focus on the profession while in a non-occupational therapy post. Professional development, along with active participation in the professional association and keeping up to date by reading research journals, can be a lifeline in an uncertain future.
So, I see we have a number of people with questions. We will now give the audience the chance to.
Now look at Extract 2. Extract 2, questions 37 to 42. You hear a radiologist talk about the latest trends in her field. You now have 90 seconds to read questions 37 to 42.
Thank you for the warm welcome. My name is Dr. Kelly Preston, and I'm here today to talk about the latest trends in the field of radiology. As we all know, for the past few years, information technology and digital solutions have exploded in the field of radiology. It's such a hot topic that the Radiological Society of North America recently announced that the focus of their next annual conference will be exclusively imaging information technology solutions and will not include other devices as in previous years. This pivot to technology in radiology is mostly driven by the current landscape. There is a massive demand for always-on and mobile-friendly solutions in all areas of our lives, even in the medical field. This may seem like a drawback of technology, but the medical field will need to figure out ways to take advantage of this reality. Another driver is the fast pace of innovation and advancement of available technologies. In just a few years, machine learning and artificial intelligence have made it possible to automate nearly anything in our lives, from driving to radiological procedures. The first trend that I'm going to expand on is, in fact, artificial intelligence. 2 years ago, AI started to show up in demonstrations, wowing all of us. But it was last year when AI's real-world impact became evident, when machine learning solutions for detecting biomarkers in stroke patients became a reality. Experts are also predicting that AI will lead to improvements in image acquisition by hastening MRI imaging time, enhancing CT resolution, and enabling dose reduction with PET/CT. Another particularly exciting development that AI technology could bring is a move toward a greater ability to identify changes over time in imaging studies. This advancement could be particularly helpful in mammography studies, where AI can recognize disease progression early, resulting in better outcomes for patients. AI is a trend that will definitely continue to have an impact on the future of radiology. Another example of technology making its mark is big data. Massive databases of information have been collected over the years, and now machines, more specifically machine learning, are poring over it, processing it, organising it, and most importantly, analysing it to find relevant insights. These deep learning solutions are being used to improve existing operations, treatments, and to discover new opportunities. For example, huge collections of data combined with a machine learning system can help identify better and more accurate ways to diagnose patients. Now, for a trend that doesn't involve technology. Radiologists are more necessary than ever. Yes, I said it. We are more necessary than ever, despite the worries that we may have about AI and machines replacing us. With some of the workload being automated by technology, radiologists are needed for clinical care and patient interactions. Each radiologist should serve as a point of contact for patients, allowing for better and more down-to-earth explanations of various situations, treatments, and actions that other providers may not be able to provide. In fact, radiologists will become an integral part of a care team as patients continue to push for more personalised time with their providers, which may require radiologists to reimagine imaging workflows that aren't compatible with offering more face time to patients. It will take time to make these changes, but they will be beneficial for our patients and the future of the field of radiology. Another technology-free trend is the growth of interventional radiology and its divergence from diagnostic radiology. As these two specialties continue to diverge, we will have to continue to develop different residency curricula, different clinic emphasis, and procedural work will be done less and less by diagnostic radiologists. For many years, techniques of interventional radiology were only used to make cardiovascular procedures less invasive, but in recent years, these techniques are being used in neurology, gastroenterology, and urology. Last but not least in this list of trends are the challenges that the field of radiology faces. One of the biggest stumbling blocks that radiologists continue to face is convincing referring clinicians that we, the radiologists, are the experts with imaging and should be able to communicate directly with patients about the results of imaging. It is often difficult for referring physicians to cede control to other specialists like radiologists. Let's hope that the trend for next year include increased communication with patients.
That is the end of Part C. You now have 2 minutes to check your answers.